Hi everyone, Dr. Kalaiko here, and if I seem more relaxed today, it's because I was finally able to vaccinate my own child against COVID-19 yesterday. So I had mentioned before I have a 6-year-old child, and she received her vaccine yesterday. She's doing great today. So she's been complaining of a sore arm. It started maybe 20 minutes or so after I gave her the shot, and the soreness is continuing today, and we expect that soreness will start to diminish maybe around tomorrow or so. But so far, so good. She's doing great. And so today I really wanted to talk about the vaccines for younger children in this age group, ages 5 to 11. So as most of you know, the CDC and the FDA have authorized the Pfizer vaccine for children ages 5 to 11. So I want to talk a little bit about the safety and the effectiveness of the vaccine in this age group specifically. So the clinical trials that were reviewed by the CDC and the FDA included about 3,000 children in this age group who received the Pfizer vaccine. And they were followed for 1 month for general side effects and for 6 months to look at serious side effects. Now the dose in this age group is smaller than the dose for older kids and for adults. So the dose for ages 5 to 11 is 10 micrograms. That's 1/3 of the dose compared with the dose that's given to patients ages 12 and over. So let's first talk about effectiveness or efficacy. So in the efficacy data from the clinical trials, this dose in this age group showed comparable levels of neutralizing antibodies. So these are the antibodies that allow our immune system to fight off a potential infection. So they showed comparable levels of neutralizing antibodies compared with the higher dose that was given to older children and adults. And in some supplemental data that was provided to the FDA and the CDC, it showed that the vaccine is 90% or more than 90% effective in preventing actual COVID infections. Now, as far as the safety data, so I mentioned that the patients or the subjects were followed for 6 months. And so it showed that the local side effects, so things like the sore arm, the redness, the pain at the injection site, these were very similar to the side effects that were seen in older children and adults. Now, as far as systemic side effects, so things like fever, chills, body aches, nausea, vomiting, diarrhea, those type of side effects, we actually saw a lower rate of these systemic side effects in this younger age group compared with the older patients. So a lot of that might be attributed to the fact that this is a smaller dose. And so they are less likely to feel these more, full body side effects. There were no serious side effects or adverse effects shown in the clinical trials, including anaphylaxis or serious allergic reactions, and there was no myocarditis seen in the clinical trial. It is thought by pediatric cardiologists that myocarditis is less likely to happen in general in younger kids versus people who are in their teens and 20s. So to account for, the possibility that, there could be hypothetically some cases of myocarditis that could be observed in this younger age group, Dr. Hong Yang presented some models to show, to kind of weigh the potential risks versus benefits of giving the vaccine to this younger age group. So this sort of discussion about myocarditis, this was deliberated upon by the panel members of both the FDA VRBPAC committee as well as the CDC ACIP committee for a long time. So there was a lot of discussion on this topic. So here's what we know about myocarditis. So based on studies of myocarditis before the pandemic, during the pandemic, and after the vaccines became available, they have showed that myocarditis is generally most common among teens and adults between the ages of 16 and 29 years. And myocarditis is generally much more likely to happen in males versus females. So people actually can be walking around with myocarditis and not realize it until actual symptoms get triggered by something. Oftentimes, that could be an infection, and sometimes it is a vaccination that might cause those symptoms, such as chest pain. That's one of the most common symptoms of myocarditis. Most children and teens recover from myocarditis. And there's many different causes of myocarditis in general. One of the most common causes is infection with a virus or a bacteria, for example. So remember, COVID infection itself also causes myocarditis. And for children with heart conditions, Dr. Oster, who is on the FDA VRBAC committee and is a pediatric cardiologist, said on the record that he is much more worried about bad outcomes from infection with COVID than he is from the vaccine. So that means that the risk of bad heart outcomes for kids that are susceptible for heart conditions is much higher with COVID infection compared to the risk with getting the vaccine. So up to now, there have been no cases of fatal myocarditis that have been attributed to the COVID vaccines. So this is after thorough investigation of all the cases that are reported in VAERS. This is the Vaccine Adverse Event Reporting System. They review medical records, they look at autopsy results and many other sources of data on these cases to do a thorough investigation of what the root cause was of the death. And so far, the fatal cases of myocarditis that have been reported have not been attributed to the vaccine. They have been attributed to infections. So that might be some kind of viral infection, bacterial infection, or something like that, but not caused by the vaccine. So overall, the risk of having a bad cardiac event is much higher if you get a COVID infection compared to if you get the vaccine. And this is true at all ages and for all genders. So what about long-term effects? This is one of the most common questions that we get from concerned parents. So the good news is that with vaccines, we see side effects of the vaccines within days and weeks, not within years later. So vaccines don't stay in our bodies long-term. Specifically with the Pfizer vaccine, and this is true also of the Moderna vaccine, that mRNA molecule gets injected into our muscle, and then it gets degraded quickly. So this is why these vaccines have to be kept at very specific temperature ranges, and they expire quickly because they're fragile. They don't stay and they don't stick around. So it's not the vaccine that stays in our body. It's the antibodies that our immune system makes that stay with us for several months and allow our body to recognize a potential virus and fight off that virus if we get exposed to it. So I've mentioned before that there's an uncomfortable reality for those of us who are parents, and that is that our children get exposed to risks every day. When we drive them to school, they are at risk of getting hurt in a car accident. And so what we do is we reduce that risk by buckling them into their car seat with a seatbelt. And that risk of them getting hurt now with the car seat and the seatbelt is not zero, but we've just increased their chances of survival significantly. So similar with vaccines, vaccines have never been 100% effective, but it is our most effective and safest tool at preventing COVID infection in our children. We know that our safety monitoring system works. It's extremely responsive. We saw that when we identified the rare blood clots that were happening after the Janssen vaccine. But, if you as a parent or a guardian want to wait and see how this vaccination rollout goes and how the children do, that's okay. So right now, the Pfizer vaccine has FDA emergency use authorization, not yet full FDA approval. That comes later. And so states and jurisdictions with vaccine mandates, for children that go to school, for example, those don't go into effect until full FDA approval, which is not yet, but possibly sometime next year. So on a personal note, my decision to vaccinate my child is based on my desire to prevent COVID infection. And I want to avoid the possibility of any long-term effects of COVID for her. So multi-system inflammatory syndrome, myocarditis, other possible long-term disabling conditions as a result of COVID infection. That's what I'm trying to prevent here. And I know that the risk of those bad outcomes is much higher with COVID infection than there is any risk of, bad outcomes from the vaccine itself. And that's not even mentioning the tremendous social and emotional impact of COVID on our children so far over the past year and a half. So just to recap, the burden of COVID in children, there have been 1.9 million cases of COVID in this younger age group, 8,300 hospitalizations, over 2,300 cases of multi-system inflammatory syndrome as a result of COVID infection, and 94 deaths from COVID. There are children in the ICU, and there are children who die from COVID. Not to the same degree as adults, but it does happen. And keep in mind, we vaccinate children against diseases like influenza, measles, other diseases which have lower fatality rates compared to COVID. So that keeps it in perspective. COVID is actually the 8th highest killer for kids in this age group over the past year. And so this is a fatal disease that is now preventable. So we know there have been 3,000 doses of the Pfizer vaccine given to children in this age group from the clinical trial, and over 1 million doses already given across the country over the past week or so. We know there have been 400 million doses of the mRNA vaccines given safely to people ages 12 and up across the country. So for me as a parent, it's a clear choice. The risk versus the benefit calculation clearly to me shows that the benefits of the vaccine outweigh the potential risks. And the CDC and the FDA agree that this is true of this age group. So I hope that information is helpful to you and helps you to make an informed decision for you and your children. Thank you.